Hello everyone, I am your obstetrician and gynecologist Dr. Ankita Mandal, and welcome to my series of Bump to Cradle. So as new mothers, you must have a lot of queries regarding the fetal movements, that how often my baby must be moving, what are the type of movement, when I should feel the fetal movement, when I should consult you, how about when if they are less or not. So all these queries are there, and I'm here to I will try to sort out all your queries. So if you are a first time mother or first time pregnant, then it is usually that you will feel your fetal movements by about 18 to 20 weeks. But yes, sometimes it can be as late as 24 weeks also. And why it is so? See, as a first time mother, you may not appreciate the fetal movements very early, because initially the fetal movements might be very soft, and later on they develop a rhythmic pattern. Like, there can be different types of movement, like butterfly movement, like a gas bubble, or like a muscle cramp also you can feel the movement. So with time it becomes more persistent, and it becomes more continuous, and then you are able to appreciate the movement. But if you're a second time or third time mother, you can feel the fetal movement as early as 13 weeks also. Now, when there are some women, they experience the fetal movement little less, and there are two conditions when they will experience the fetal movement less. That is, first is if the placenta is on the anterior wall, and second if the mother is having high BMI. Now, how to calculate the fetal movements? Usually there are many apps which you can see, many trackers which you can see, but I will tell you a very simple method with which you can know the fetal movements. So you will take a piece of paper and see, just see the watch, or start a stopper. See how many movements are happening in 1 hour. So usually it should be, it should be at least 10 or even more than that. And if a baby is having less movement than 10 in an hour, it is also normal. But you have to keep a watch, because if the fetus is having that pattern of movement also, that is also normal. And usually the fetus has some sleep time also, which can be about 20 minutes, and it can be extended to about 40 minutes also. So it's very normal that even if you are having less than 10 movements in 1 hour, that also we take it to be normal. Only thing is that you have to see the pattern of the movement. Okay, and the second thing is count to 10. That is Cardiff's rule of count to 10, in which we tell that you just start the stop clock, and till when is the time when you are able to perceive 10 movements. So it can be, it can be 40 minutes, it can be 60 minutes, it can be 90 minutes also, and it can be as long as even 2 hours also. And that also we take it to be normal. Only thing, as I already told, that you have to see the pattern every day, whether there is any change in the pattern or not. Now, when you have to be very serious about the movements, that yes, it is less. When you have any other comorbidities, like if you have gestational diabetes mellitus, if you have high blood pressure, that is PIH, or you have intrahepatic cholestasis of pregnancy, or any other high risk factor, then you should be very much be aware of your fetal movements, and you should inform your obstetrician at the earliest when you feel that the movements are less. So these are the few points which you have to keep in mind about the fetal movements. So enjoy your motherhood.